No, no. She's saying that because she can't hear us. Yeah. Okay. Are you?
Can we start, Mr. Khurana?
You have to be a bit louder, Suresh.
Mr. Khurana, can we start?
Well, if you desire so, we are.
Okay.
It's
I'm a pretty punctual person.
Yes.
So if you
Thank you.
say
Thank
3 o'clock, I
you.
need to finish. I'll finish on time. Don't worry on that. And in case you want me to start early, I'm happy doing that.
it's we because we have all the people that we've invited. We can see that they have logged on and
Sure,
they have
sure.
joined on the
More the
call. So
merrier. Then we can consume this time in terms of question
exactly,
answer.
exactly. It's about giving ourselves a little bit more time for questions.
I can speak for 10 hours at a stretch on the same topic, so it's okay.
Okay,
So
so I welcome everyone to the last session of a two-day workshop. Um, our first speaker is Mr. Rajiv Khurana. Mr. Khurana is the founder trustee of Lung Care Foundation, New Delhi. Lung Care Foundation is a not-for-profit organization dedicated to the cause of promoting lung health in India. Mr. Khurana will be speaking on the impact of air pollution on health and well-being. So, Mr. Khurana, like we have planned with the other speakers also, so it's 20 minutes of your presentation and then we keep 10 minutes for question answers.
Perfectly fine. So
Yeah.
I'll go as per my watch and your watch and
Yes.
confine myself to 20 minutes.
Yes.
Allow me to load my presentation in the meantime.
Yes.
So can you see the complete presentation?
we can.
Yes.
Wonderful. So good afternoon, friends. I would only say happy breathing. In today's time, if we can actually breathe clean air, it's wonderful, delightful. And that could happen in Delhi only last year when we were confined to our homes. And, we could talk that, okay, now the hills are also visible and the stars are also visible. Otherwise, when you look up, the stars are there, but you can't see because stars are being suffocated by the air pollution that we keep creating. In this short presentation, I'll be talking in terms of the impact of air pollution on the health part. And also, since you are all media professionals, I'll talk on in terms of how the media impact could be created in terms of mass awareness. The trouble in India so far is that air pollution is still a class issue and not a mass issue. People who are familiar with technology, people who are familiar with technical jargons talk about it in a language which others don't understand. And people who should understand are not even bothered about it and they are also not aware about it. For example, we did a study in Delhi whether people knew about AQI, and 92% of the people said they have no idea about AQI. And rest, there were other questions also, and people were massively ignorant about it. I've used the word impact, and if you see the colors, it also says I act. This is the responsibility all of us have in terms of gearing up to take the responsibility and act, and let it not be confined to just 20, 30 people sitting in the conference room and listening to me, because this is one area which everyone in this world is really, really concerned about and should be concerned about. Someone once asked me, who is your target audience? And I said, anyone who breathes is my target audience. And this also includes living beings, because the humans have actually spoiled the air for the other living beings, and we have no right to spoil their breathing. My friends, could you just tell me how many times do you eat in a day? You will say, hey, 3 times, maybe 4 times, 5 times, or 6 times. How many times do you drink? And I'm talking about tea, coffee, soft drinks. Later evenings drinks are excluded. You would say, hey, maybe around 10 times. And now, for the next 10 seconds, count your breathing and tell me how many times do you breathe in 24 hours? Time starts now. All right, 10 seconds are over. Could you tell me the numbers, please? Any guess? How many times do we breathe in 24 hours?
In 24 hours.
Sorry?
10,000. Just getting responses, sir. How many?
Just give
10,000?
me any, sorry?
10,000?
10,000. थोड़ा rate बढ़ाओ.
20?
We breathe 25,000 times per
22.
day,
Okay.
and we take 10,000 of liters of air inside us. Now imagine your AC, which has a filter. Every 1 or 2 months, you need to take the filter out, wash it, and keep it inside so that you could get some better quality of air through your air conditioner. The trouble is, when you inhale 10,000 liters of air per day, 20% of that is oxygen. You cannot take your lungs out, clean it, wash it, keep it inside, because lungs, once become dirty, remain dirty. There is no way to clean them unless you are on the operation table and the doctor only says, अब इसको दवा की नहीं दुआ की जरूरत है. And that is where Lung Care Foundation came into being. We are committed to the care and cure of 2.6 billion lungs of India. Well, India is a very romantic country, and therefore, this population number will keep on increasing, and our commitment will keep on going up and up and up. But we focus on three things primarily. We focus on awareness creation, and this is where the role of media comes in. We focus on clinical care. We organize plenty of clinical camps, and we also do a lot of research, which I'll be talking to you about. And we do this with multiple of activities. This is not an organizational presentation, but just to give an overall glimpse that we carry out a lot many activities, including, a few years back, we had created a Guinness World Record, which is lying behind me. And our major focus has been that in the society, if we have to bring about certain changes, we need to work through two entities. One, the youth, and second, the doctors. Because doctors can actually guide everyone well. But it is the youth, especially even the school going kids, who can bring about change from within the family itself. Because when the kid says, Dad, switch off the car, the dad will switch off the car. If the kid says, Mom, let's reduce the power consumption in the family, the same thing will happen. And let me tell you, even that kids in the classes of 6th, 7th, 8th are the most effective kids as per us. And when we talk about the youth in India, between the age bracket of 15 to 29, there are 45 crore youth in India, and the number is increasing. So, in case they don't bring a change, what kind of a change will happen, we do not know. And this is our progress over the years. In fact, we started, our first program was with class 5 kids in a primary school, Municipal Corporation of Delhi in Shalimar Bagh. And from there, we have moved a long way, including programs for the principals, Guinness World Record, working along with the doctors, focusing on distribution of medicines, oxygen concentrators, oximeters, etc., to far off remote villages. And we served 80,000 villagers in terms of providing them medicine through the COVID time. But now coming back to air, I mean, this was a very quick, brief commercial that I wanted to share with you about Lung Care Foundation. But when we talk about breathing, actually, we breathe lot many things. We breathe carbon dioxide, sulfur oxide, nitrogen oxide, carbon monoxide, volatile organic compounds, we call them VOC, and many other things along with that which come into us, we inhale. But most importantly, people are more worried about particulate matter 2.5, particulate matter 10, and now we are also talking about nanoparticles of less than 1 micron. What are these? We need to understand that. Can we do a small exercise? Just take one hair out of your head, please. Just one hair and look at it. And in case you find that painful, just pluck it out from your neighbor sitting next to you. And now admire your hair, please. That hair has a 50 to 70 micron thickness. Now tear it off into smaller pieces, smaller strands, and maybe make it into 2.5 micron, which will be 1/28th the size of this hair. You cannot see that, but we inhale it. We inhale it, it gets into our lungs, and 2.5 and below actually find way to get into our blood vessels. And when it gets into our blood vessels, it starts traveling to all the places in the body. And then it starts depositing. And then blockages happen. Otherwise, where would the stuff come into your heart or in your brain, in your kidney, in your livers, or whatever? It starts affecting everything. It takes time. But it does start getting collected in your body itself. And that is where PM 2.5 today is pretty dangerous. So, where does it not affect in your body? There is no part of your body which doesn't get affected. And even if you want a glowing skin, air pollution spoils that also. So, those who want to look smart must blame air pollution for that. So, whether it is your gallbladder or brain or heart, everything gets affected. And people are not just worried, bothered, or not even aware of it. The first case in Britain was recorded of Ella, 9-year-old, certified death due to air pollution. In India, it still doesn't happen because in the death certificate, the cause of the death could be old age, the cause of the death could be heart problem or stroke. But what is behind all that? We don't make a note of it. And the trouble is today, 16.7 million people, lakh people die every year in India due to air pollution. World over, it is 7 million, 70 lakhs. So if you really convert that into it, by the time you count 1 minute, there are 3 deaths happening due to air pollution. Every 20 seconds, one person in India is dying due to air pollution. Isn't it startling? But then, when we talk about the death, it is only tip of the iceberg. But below that, you will go to hospitals, you will have chest issues, asthma problem, COPD problem, various lung diseases, respiratory problems, and lakhs and crores of people suffer every day. So imagine the time when you're working on your computer and your nose is actually dripping, you are not able to concentrate. It is due to air pollution, unfortunately. You are not able to work. The organization doesn't realize. They give you a chutti and the productivity is lost. And this happens in terms of billions of work days in India. And therefore, our fight together has to be against, in Hindi we say, do dhu. धुआं or धूल, smoke and dust, smoke and dust. Smoke from the industry, waste burning, cars, crackers, other sources, dust from roadside construction, open grounds, uncovered areas, and we need to protect ourselves from all of this. This was the startling picture with which we focused on Lung Care Foundation creation 7 years ago. This was the same picture with Mr. Gogoi, the MP, took it out in the parliament to highlight the problem of air pollution. The pink lung and the black lung, and Delhiites will not have the pink lung. And there is no machine through which you can see on a daily basis how your pink lungs are becoming dark, unless and until you are on the operation theater, operation table. And this disturbed Dr. Arvind Kumar, and he, being my friend, we discussed and we created Lung Care Foundation 7 years ago. And today, life of 1.3 billion people of India are being affected. Mind it, my dear friends, we are living in Bhopal gas tragedy in slow motion, and we are not worried about it. As per the chairman of the WHO, this is the second tobacco epidemic. In Delhi itself, on an average, we smoke 11 cigarettes a day, even the newborn. After that, the smokers start enjoying their disturbing factor of their health. But everyone is a smoker, even if you say that we are a non-smoker, because the air pollution is the new tobacco new epidemic which is happening. And our researches are showing, we did a study on asthma. We have even an asthma manual printed in 11 Indian languages for media professionals. Let me show you a copy of that. This is available on our website. You can actually download that from there freely. And we found that 29.3% of the adults and children in Delhi, and we compared Delhi with Mysore and Kottayam schools, 1,000 kids each. And we found Delhi kids are more vulnerable to asthma, with 29.3% having asthma. 90% are not even aware that they have asthma, so therefore no treatment is happening. And boys have the double damage and danger in terms of asthma. So girls, be happy. This time the boys take the lead. And of course, these kind of studies, National Green Tribunal, etc., is now hammering the government that take whatever Lung Care Foundation is talking about through the research into serious cognizance. But if you really think in terms of what all has happened over the period of time, my friends, you'll be surprised. And this is what Dr. Arvind Kumar, during 34 years of his surgery experience, talks about. That in 1988, 90% of the lung cancers were due to smokers. Today it is 50-50. Second, the average age of lung cancer used to be around the age of 50 to 60. Today it has come down to 30 to 40. We have 28-year-old kids also going through lung cancer. In one of the cases in Shadra, New Delhi, the guy felt, well, I have never smoked. Why has this happened to me? Why me? But wherever he lived, both sides of the road had furnaces, and he grew into that pollution. And unfortunately, one lung had to be removed. We had a 32-year-old lady, mother of three, lost her life from Punjab village. We say villages are pollution free. Well, yes, but she lost her life. Earlier, there were no women going through these kind of problems. Now, 40% of the cases are of women. Well, colors of lung by birth are pink in non-smokers and black in smokers. Now, there are no pink lungs available, unfortunately. And this is, in simple parlance, I'm talking about the health impact due to air pollution. I'm not a doctor, you're not doctor, so we're not getting deeper into the medical aspect of it. This is where I'm talking in terms of a journal understanding factors of this. And who gets affected the most? The unborn babies, the children, the elderly. And when the pollution season, which is about to start again in September, actually, we say the festival of pollution starts in September. But unfortunately, in Delhi around, pollution happens around the year. We blame Parali, the burning of the leftover in the field. But Parali's impact in winter is 4% and in summer is 7%. And we don't realize all this aspect. But the trouble is, we all have to suffer. And when we talk about impact in Delhi, wherever it is coming from Punjab, the villagers get affected first before the air brings Parali to Delhi and Haryana, unfortunately. let's talk about, I also released a video recently in terms of the economic impact of air pollution. I'm a practicing management consultant, trainer, and a writer. So I come more from a commercial background, management background, and I produced a movie called that what is the economic loss. And you'll be surprised, in the year 2019 we lost close to 225,000 crores due to lost output from premature deaths attributed to air pollution. And at the same time, the businesses across India lost 742,000 crores each year just because of air pollution. Now, if this is not alarming, then what would be alarming? We do not know. And on top of it, we suffer three frauds. My dear friends, please note these frauds. The first fraud on us was when we started buying the water bottle. Oh, it is just 10 bucks. So what? Let's have pure drinking water. A major fraud on us. You know why? Because God has given us water absolutely free. And now we have to just bottle it. And I was in Europe last week, and I had to pay the same bottle which is available in 20 rupees in India. I had to pay 200 bucks for that, and in many places even 500 bucks for that to drink water. What a fraud. And this fraud, because of this, world over, the bottled drinking water market is 349 US billion dollars. God has given us water free. We are supposed to have it. But we are paying 349 US billion dollars world over to have it from a bottle. What a fraud on us, and we don't raise our eyebrows. The second fraud on us is oxygen. We all know last year what kind of a problem we faced due to paucity of oxygen during COVID times. And now we are very, fashionably talking about, in Saket Mall, a restaurant is offering pure oxygen at a price of only 299 rupees plus GST. Damn it, you are an idiot, you are a fool. And you talk about it in a more fashionable way, because if you start calculating the cost you will have to pay at constant price, how much money do you have to pay? If you're a family of 4, God give you long life, but you are going to live for say 80 years. Then for 80 years, your family at the same price of 299 plus GST will have to pay 335 crores, 26 lakhs, 27,200 rupees plus GST. Are you going to earn that much of money? It's time we wake up. This is a fraud on us. God gave us oxygen free. And now we have to purify it. We have to install machines. What a big fraud we all have to live in. And media professionals need to raise voice about it. The third fraud, the smoke towers. Very fashionable. 20 crore ka smoke tower in Delhi, Connaught Place, which is still not working, will actually create the whole damn thing for 500 square meter. And if Delhi has an area of 1484 square kilometer, you will have to spend close to 60,000 crores only to install smoke towers, plus the cost of land, plus the cost of operations. Who's going to pay for it? We have to pay for it. So why not pay for air pollution at the problem level, so that there is no air pollution, rather than the bus passing by creates the pollution and then we install the machine to clean it? Well, if people are committing fraud on us, let us admit we are number one idiots. And if we do not realize it now, I do not know when are we going to be realizing it. And that's where now the role of the media comes in. Well, Lankyar Foundation has more than 500 plus articles and interviews in print and electronic media, including last week. We were also there on the PTC Punjabi, where I was being interviewed along with my doctor colleague in terms of
Sir,
what
excuse me.
kind of impact air pollution is creating on us.
Okay.
And I really do not know whether you are able to hear the voice or not, video. Otherwise, I'll proceed further. I will just explain you about the video.
Sorry
Tell
to
me, are
interrupt.
you able to hear the voice?
We are not able to hear the audio,
Audio.
Mr. Khurana, but
Okay, no
Sudeshna
problem.
is
Then
also
I'll
trying
proceed
to
further.
let you
Yes.
know that how much
Yes,
time
two
has he.
more minutes.
2 more
Sir, 2 more
minutes.
minutes.
Don't
We'll have
worry,
questions
we'll
then.
finish in 2 minutes' time.
Yes.
So we created also a video on Chula where we say You say that the lady, when she cooks, on chula, the food tastes better. Well, food tastes better because she has a skill of good cooking, and not because of chula. But when she works on chula, she smokes 100 to 400 cigarettes. And we also have a video production of Voices from the Womb, where a small child from inside asks the question that you have actually spoiled the whole world for me. Should I take birth or not? So these are some of the productions that we have actually done. And we have also used the wall as a medium to exhibit our ideas. The long wall that you see in this picture is the IFCO choke wall, and then just below that is the Huda Gymkhana wall, and on the left bottom we have an urban slum where we have actually involved the people in terms of making a painting. We have many more pictures of Lucknow, etc., but due to paucity of time we are not able to show you that. And then, in terms of communicating with the doctors, we have designed multiple posters. And I'll give you an example that in one of the posters, we gifted these posters to the doctor, and the Punjab launch in the Jalandhar hospitals, the doctors have displayed all these posters for their own staff as well as for all the patients in terms of how does air pollution affect the health of people at multiple ages and stages. And therefore, to conclude, I would only say that in Hindi, or the media professionals, especially I'm sharing this, देश को कागज पे अब कम बदलते हैं, सोशल मीडिया की चमक से बाहर निकलते हैं, अपने क्लिनिक और दफ्तर से थोड़ी दूर टहलते हैं, एयर पोल्यूशन कहाँ कैसे असर है करता समझते हैं, हर दिन कुछ बात करने को ठहरते हैं, सभी का साथ है जरूरी, सोच सुलझाते और खुद सुलझते हैं, देर हो चुकी है इंडिया एट 75 पर, थोड़ा डरते हैं, एक दो ही सही कुछ पॉजिटिव काम को दिल से करते हैं, देश को बदलने की बातें छोड़ अपने परिवार के लिए चल पड़ते हैं, आइए हवा बदलते हैं, HAWA Health and Air Pollution Widespread Awareness. This was written by me, and I thought this could summarize the challenge before the media professionals. I wanted to share another video with you, which we have created, and at first time I became a lyrist also. This song has been recorded by a Bollywood singer called Sochona. The second one is being recorded called Rap Ka Rap, Reducing Air Pollution Ka Rap. Both have been written by me. The second one is being recorded and should be released next month. But we believe that storytelling and depicting all these things with the help of people is only going to bring about certain awareness and certain change. Thank you so much. I'm looking forward to your feedback. Thank you.
Um, Thank you, Mr. Khurana, for that talk. I'm sure we'll have questions on this because we have filmmakers who are looking at air pollution from the point of view of health. So, yeah, questions, please.
I hope you guys liked the presentation. I wish
It
Yes,
I
was,
sir.
had more.
Yes, sir.
it's really great to see the kind of work that you are doing. It's very impressive in its scope and in its quality. Very inspiring.
Thank you so
Yeah.
much.
Questions?
In fact,
So,
we need more volunteers to come and join us from the media profession. I can even offer internships to people who wish to work on various projects so that more and more communication could be created and spread all across India in multiple languages.
okay.
Okay.
If while we wait for questions from the floor, this is Pavis Bisht. I'm the principal investigator for this research project, Mr. Kurana. So could I just ask? I mean, this is really great. The kind of work that you're doing with the, with the media side of things. Have you also tried to engage with policy actors? With
Yes,
you mentioned Mr.
yes, yes,
Gogoi was
yes.
there. Could you tell us a
Sure.
little bit about that work?
We have, after COVID, last September, we started from Lucknow, and I called Air Pollution Facts to Act. And later on, I created a concept called SHAPE UP, SHAPE. I'm very fond of creating acronyms, so all these acronyms I create. So SHAPE stands for Solutions for Health, Air Pollution, and Environment. So this is Shape UP. Now we'll take it to Shape multiple states, and it could be Shape India also. So we have already done a program in Kanpur, and we also have an MOU signed by Gurgaon Metropolitan Development Authority and Gurgaon Municipal Corporation. So when we talk about policy matters, I always say, hey, it is not the central government or the state government. Even the municipalities work on the policies, procedures, and practices. So we need to engage them. We work also with RWAs. We have a program with Urja in Delhi, United Residents Joint Action Group. And I always say that even a panchayat in a village is also an RWA. When we start engaging them properly through a language which they understand. You see, the trouble in India is we think about changing India, but we think about changing India in English language. It is important that we need to get down to regional languages. Even Hindi has more than 70 crore people understanding it, and therefore we create a class divide. So we become classes and we start telling the masses. It is important that we think like a common man and work like a common man. Therefore, when we even do programs with RWAs, we engage them that, okay, fine, here is the wall, we are going to be painting. We bring our artists, they make an outline, and then we all ask the RWA guys to come and paint the wall along with us. Fill in the colors, the kids' activity. People enjoy that activity, and then they take on the ownership of that. So these kind of things have actually happened in Lucknow. We painted two huge walls with the help of local people. And in Delhi also this weekend, again, we are doing a wall painting in Vasant Kunj, this time at a premier location. Because even them, they need to understand that cycling becomes, we are calling it joining the war, which is waste segregation, adopting cycling, and reducing power consumption, WAR. Let's create those kind of war. So when you engage these people, people listen. So today even the governments are after us to help them out, and now I'm on various committees by the government, including international committees where we come onto the policy. But then these are very slow moving activities,
Sure.
and many a times I feel the time gets wasted because their actions are slow. But then the very fact that we are there, at least someone listens to us.
Of
And
course.
now NCDC, the government department is asking us to write a chapter on air pollution for doctors training across India in one of the book that we will be creating and contributing. So there are plenty of these activities which you. So policy document doesn't mean you should always tell them. It is also important to work along with them. And I always say that we are not an activist body. My team will not go to India Gate to light a candle. We will not demonstrate at Jantar Mantar. We will not, raise our voice and sloganeering like any other activist or NGO will do. We will work along with people. Government has a role to play, whether they are efficient or not, let them do whatever they are doing. But at the same time, it is important to involve the public. If public is not involved, things don't. I mean, you'll be surprised. Last 2 days back, I was talking with someone. He says, I said, why don't you involve people in your area? He says, my area? If I ask them for a cocktail in the evening, everyone will come. If I ask them to come and work on a social cause, nobody will come. So we need to create that kind of awareness in public itself. So a public-private partnership, it is important that we give them a proper jolt. And therefore, I always follow three-pronged strategy. One, a wake-up call. Second, a shake-up call. And third is a make-up call. You need to wake up people. The trouble is, people who pretend to sleep, we cannot wake them up. So you really have to bloody well shake them up. And then once they've woken up, shaken up, we need to also work along with them in terms of what are the solutions? And this is not going to be an easy task.
So more questions from
So
the
we
floor.
can, yeah. Any more questions?
I have one data specific question.
Go
Yeah.
on, Amit.
He said a newborn takes 11 seconds a day. In how much time does the sample last? Is there a data?
So there's a question from the floor. I don't know if you heard that, Mr. Khurana. Could you
No,
hear
no.
it?
I'm
So
fine.
there's one of our shortlisted filmmakers, Amit, is asking. You presented a fact about a newborn
Yeah.
breathing every 11 seconds.
11 cigarettes a day.
Cigarette.
11 cigarettes a day.
Yeah.
So could we put a time frame on when the lungs turn black, for a child like that who's breathing in 11 cigarettes a day?
Okay. I can only give you an example. Generally, it is found world over that 30 years of smoking, the person gets into the danger of having lung cancer. Now, every body is different. So each body reacts differently. So some of the villagers using hookah at the age of 90, nothing goes wrong with them. But someone who smoked cigarette for 30 years, I lost my elder brother who smoked for more than 30 years due to throat cancer. And he used to always say, I wish I had heard you, because I kept telling him, stop it, stop it, stop it, but he never stopped. Now, if 30 years of smoking has a result, today smoking starts when the child takes birth. So 30 years is when you are born. So it is not at the age of 50 to 60, it is the age of 30 years or 40 years when the danger of lung cancer starts happening. But is there a parameter? Is there a timeline? Is there a wall clock which says that, okay, after this you are going to have it? So just 2 years before that, if you stop, nothing will happen to you? No way. But the danger is very, very alarming for everyone. And let me tell you, people say rural India is clean. I challenge that. Because the home designs are so that the ventilation doesn't happen. The chula the kitchen is inside. There is no ventilation. The lady inhales 100, 200 cigarettes. The child is sitting next. And then the smoke is actually embedded into all the fabric around. So when the whole house is poorly ventilated, you keep inhaling the same stale air. What is happening to your lungs? They are getting spoiled. And let me tell you, you come and sit with us and we'll give you more information and data, because in half an hour's time, we'll not be able to actually give you enough. You want to make movies? I'll give you 10 more ideas in terms of making of movies.
Okay. Thank you so much for that, Mr. Khurana.
Thank you.
Yeah.
It's been a real pleasure.
Pleasure. Yeah.
All right. So we
Yeah.
call
Thank
it
you
off
so
now.
much.
3 o'clock
Yeah.
sharp. Thank you so
Yes.
much.
Thank you, sir.
Thank you so
All
much,
right.
sir.